I would first like to invite Dr. Vidya Patil, who is working with the Karnataka Health Systems Resource Center, and she will be sharing the findings of evaluation of skilled birth assistance training program in. This is a very important issue because usually we talk about numbers. Do we have enough doctors? Do we have enough nurses? But to look at the competencies of the staff is the next level, and I'm glad that the Dr. Vidya Patil has done this research. And over to you, ma'am.
Good afternoon, everyone. I would like to present the study titled as Evaluation of SBA Training Program in Karnataka. And this study we did in, KSHRC has done this study in collaboration with IMAX. Excuse me, first slide is not coming. Not this one. This one, no? Second one. To start with, Government of Karnataka in the background to ensure universal coverage of all the births with skilled attendance. With this objective, the state government, it has introduced SBA training program in year 2009 and 10. And in this scenario, the SBA training for all the staff nurses and ANMs, it's being undertaken in all the districts in all 30 districts of Karnataka from 2009 and 10. And KSHRC has taken this evaluation with the broad objective of comprehensive evaluation of the implementation of the SBA training program. That we have taken the data for 2 years, that is 2009 and 10 and 2010 and 11, across the 30 districts of state of Karnataka. So the broad objective is again to assess the strength and weakness of the SBA training program, specifically focusing on the implementation methodologies and infrastructure for SBA training. To be more specific, I would like to mention some of the specific objective behind undertaking this evaluation. To assess the role of SBA in reducing MMR by analyzing the trends in MMR through comparisons of the data before the initiation of the SBA training program in the state and after the launch of SBA training program. At the same time, to obtain statewide and district-wide estimates of delivery by skilled birth attendance, and to assessment of the training program and evaluation of after training performance of the SBAs. SBAs, again here I would like to mention, staff nurses and ANMs who have undergone SBA training for the last 2 years, 2009-10 and 2010-11. And at the same time, the state was very keen to evaluate this training in terms of planning, implementation, and impact on MCH indicators. So these are some of the specific objectives behind undertaking this evaluation. Regarding the sample size, we have taken a total of 706 SBA trained personnel, out of which there are 404 staff nurses and 302 ANMs across 30 districts. And for the research technique which we have used for selecting this sample size is multi-stage stratified random sampling. And again, for per district, we have selected 12 staff nurses and 11 ANMs per district. About the methodology, we have evaluated the knowledge test as well. We have evaluated the knowledge as well as skill evaluation of the SBA trained ANMs and staff nurses. At the same time, we have focused on assessing the training infrastructure evaluation. Apart from this focus group discussion with the key stakeholders like DTC District Training Coordination Committee principals, trainers, as well as staff nurses, ANMs, and obstetricians, pediatricians, and state training institute stakeholders. And the main study constraint of this evaluation was there was lack of availability of data district-wise, that IMR and MMR data, and district training center data on pre and post-training evaluation, because of which we were not able to do the trend analysis of IMR and MMR before the launch of SBA training program and after the launch of SBA training program. Because since the state was keen on to assess the impact on MCH indicators also, so we had initially had put one of the objectives as to assess the IMR and MMR district-wise, that to specifically focusing on pre-SBA training program and then post-training program. But since there was a lack of availability of data district-wise, we were not able to do, as I said, the trend analysis. Regarding the findings of knowledge evaluation, under knowledge evaluation, the performance of the SBAs were assessed under knowledge evaluation, under knowledge test. Like we have taken some parameters like antenatal care and intranatal care, postnatal care, management of normal pregnancy and childbirth, and identification and management of complications during pregnancy and childbirth. These are some of the parameters or subtopics which we have covered under knowledge evaluation. So based on the findings of knowledge evaluation, overall there was 82% of the SBAs, that is total sample size, including staff nurses as well as ANM together, had knowledge about various aspects of antenatal, intranatal, postnatal, and infection control practices. Comparatively, staff nurses having relatively higher knowledge than ANMs, which counts for 83% versus 80%. This is with respect to the findings of knowledge test. Again, with respect, staff nurse had higher rates of knowledge than ANMs. With respect to specific parameters, which are antenatal care, postnatal care, normal pregnancy, and childbirth. And there was significant, statistical significant difference with respect to the, to have higher rates of knowledge of staff nurses with respect to these parameters than ANMs. Again, coming to the findings of skill evaluation. Under skill evaluation, again, as I had mentioned in knowledge test, we have taken some parameters like antenatal care, intranatal care, newborn resuscitation, and postnatal care of the mother and care of newborn, infection prevention practices. These are some of the subtopics which, against which the performances of the SBAs had been assessed. And regarding the specific findings of the skill evaluation, the average percentage of the staff nurse performing skills correctly was 93, varying from 91 to 94% for various subheads, which I just now mentioned. And again, there was a variation in the percentage of staff nurses performing skills correctly was lowest on particularly on infection prevention practices and highest on postnatal care of the mother and care of the newborn skill sets. The average percentage of ANMs performing skills correctly was 84.5, varying from 81 to 89% for various subtopics. And the variation in the percentage of the ANMs performing skills correctly was lowest on the subtopics antenatal care and highest on infection prevention practices. These are some of the comparison between skill assessment of, performance of the skill evaluation between the staff nurse and ANM. Based on the discussion with, based on the focus group discussion with the key stakeholders, these are the findings which have come out. The state policies, it focuses on staff nurses of 24/7 PHC and FRUs. They are given priority over the other staff nurses for SBA training. And the second priority is given to the headquarter ANMs. Deliveries are not being conducted at sub-center level. and monitoring and evaluation of the training is done at training site by trainers. However, the training, it's not in a structured manner. And as I said, like there is not accurate data is not available, IMR and MMR data district-wise. And most of the MMR and IMR district-wise data, it is skewed because of the under-reporting of the maternal and infant death. And at the same time, staff nurse and ANMs being trained at training centers attached with medical college, taluka hospitals are not getting enough hands-on practice for skill enhancement. And obstetrician and pediatrician were of the opinion that number of referrals of high-risk cases received by their centers has increased by 25% compared to pre-SBA training years. And obstetricians feel that the medical officers do need training in plotting the partograph, because of after which only they will be able to supervise, they will be able to monitor and supervise the SBAs. And participants were satisfied, staff nurses as well as ANM, they were satisfied with the content and curriculum of the training. However, the skill aspect of the training requires a separate obstetrician appointed exclusively for training ANMs attached with PHCs. Regarding the duration of the training, which is of 3 weeks, again it is found to be satisfactory among the stakeholders. And knowledge and skills of the nurses joining SBA training is not satisfactory. And there was this, thirst on exploring the options for integrating NSSK with SBA training for better utilization of resources and in order to avoid the duplication of efforts. Yeah. So just to highlight few observations on infrastructure, assessment of the infrastructure. Like mannequins are not available at 2 DTCs, and physiotherapy unit were not available in few centers. And the CDs, modules, presentations which were used during the training, they are not available in the local language. And partograph not being used to monitor labor. These are key findings from assessment of the training center infrastructure. Thank you.
Thank you, Dr. Vidya.